Hello, I'm Courtney Thornburg, Director of the Hemophilia and Thrombosis Treatment Center at Rady Children's Hospital, San Diego. This activity includes 4 cases of patients with hemophilia to use as a starting point to discuss the clinical implications of some of the research that was presented in December 2018 at the American Society of Hematology, or ASH, annual meeting. In the first case, we'll consider the importance of initiating primary prophylaxis in children with severe hemophilia A. Follow-up data from the joint outcome study, which were presented at the 2018 ASH meeting, demonstrate the importance of early prophylaxis on long-term joint health. The second case concerns a young man with hemophilia B who is making the transition from relying on his parents for adherence to his prophylactic regimen to taking responsibility for it himself. This year at ASH, we saw long-term clinical trial data and real-world data which show that extended half-life factor can reduce the burden of factor infusions while maintaining the prophylactic effect, especially for patients with hemophilia B. And our third case is about a young child with severe hemophilia A who has developed a high-titer factor VIII inhibitor. Until recently, prophylaxis with bypassing agents was the only option for preventing bleeding in patients with inhibitors. We will discuss ASH abstracts that address emicizumab use for patients with inhibitors, as well as recent MASAC recommendations for emicizumab in this population. In the final scenario, we have a patient whose on-demand treatment is no longer matched to his lifestyle, and he is considering starting prophylaxis with an extended half-life clotting factor. The studies from the 2018 ASH meeting that we will review focus on real-world data of extended half-life factor use and strategies for personalized care. Thank you for joining us for this activity.